There are updates in the response criteria, I'm happy to say. At the 11th International Workshop on Waldenström's macroglobulinemia that was held in Madrid, we actually revised the response criteria. Now, what do I mean by revisions? We simplified them, and we've been doing this for a long time, really using IgM to guide categorical response, and not having to burden the patients with a lot of additional workups as we used to do, such as assessments of extramedullary disease, at very short, fixed intervals. We learned that if we just follow the IgM for minor responses, for partial responses, even very good partial responses, we're going to get the same information without burdening the patient with these extra tests. And the reliability once again came from the very important Aspen study where we compared outcomes, and we saw patients did the same regardless of whether we were using more complicated criteria versus simple criteria. But if somebody is to be termed a complete responder, we will do the additional assessments, including bone marrow biopsy and CT scans. For people that are suspected of progression, of course, we will always look at where the site of progression is to make the determination. But I think this will help us honestly in recruiting patients, because when patients are presented with clinical trials, the first thing they look at is what's involved. And if it means they have to come and get scanned every 3 months, that's an additional burden and cost to the patient that we can now avoid because of what we learned as a result of the Aspen study.